Criteria for the ethical feasibility of uterine transplantation. My name is Jacques Balayla. This is my colleague Ariel Lefkowitz. We'll talk about today about uterine transplantation. The most important concept that surrounds this particular procedure is, of course, the notion of uterine factor infertility. What is uterine factor infertility? It's, in a very few words, is the absence or pathology of the uterus, which is either congenital or acquired, and leads to infertility in that regard. Now, as I've said, there's many congenital or acquired causes of uterine factor infertility, some of which are obstetric and most of which are actually gynecologic. If a woman that has a uterine factor infertility desires to have a child, the norm was, up until a few years ago, that she had to go either surrogacy or adoption. Now, for some women, there might be legal barriers to these options, as well as cultural or personal barriers. And therefore, the need or the idea of uterine transplantation came along. This has been tried in animal studies ranging from the 1960s to 2011. The first time that uterine transplant was accomplished in a sheep model, which actually led to a live birth, to successful pregnancy and a live birth. Other animal trials that are notable in the mouse, the pig, the sheep, and the baboon. Attempts in humans have ranged again from 1931 all the way to about a couple of weeks ago, as I'm sure you heard in the news, in Sweden there were a couple of mother-daughter transplant cases that so far have seemed successful. Obviously we'll have to wait. And this made headlines all over the world, including an interview I had to do on TV. There are many ethical issues, many medical issues that are adjuvant to the ethical challenges, some of which are related to the blood supply and the other surgical concerns, in immunosuppression for the fetus, and whether you transplant just the uterus, the fallopian tube, so on and so forth. But here to talk about the ethical challenges is my colleague Ariel.
Thank you, Jacques, and thank you to all of you. So we'll talk about some of the ethical challenges in uterine transplantation, and the approach we took was a principled approach based on the principles of biomedical ethics as proposed by Beauchamp and Childress in 1979. So those principles are as you see them here. And the line of ethical tension that we found drawn in the case of uterine transplantation were between the principles of non-maleficence and of autonomy. So the principle of non-maleficence roughly states that one ought to reduce harm done to others, so a variation of do no harm in the Hippocratic Oath. And the principle of autonomy states that one has the right to self-governance over their own bodies and their affairs. So the principle of non-maleficence in general weighs in against uterine transplantation, as uterine transplantation has some inherent risks, of course. The principle of autonomy supports it on a basic level, as somebody has a right to choose what happens to their body. The principles of beneficence and justice do have what to say on the matter, but we won't cover them. They are equivocal this time. You can ask me questions about it. So the concerns that we found regarding uterine transplantation, we divided into three categories regarding the recipient, the donor, and the healthcare team. Ethical concerns for the recipient include major problems with informed consent. For example, the choice to undergo a uterine transplantation is far more a social and emotional decision rather than a medical decision. Uterine factor infertility is not life-threatening, and in general it doesn't reduce the quality of life per se. The choice to undergo it in order to gestate a child is therefore far more a social and emotional decision. And this is a problem regarding informed consent, especially in the research context where the chance of success might be lower. It's important also to realize that uterine transplantation allows for gestation of a pregnancy, not necessarily having a child, as having a child is far more effectively achieved with surrogacy or adoption. Therefore, it's important to know the limitations of uterine transplantation, as it will be a denervated uterus. You may not feel fetal movements. You'll also require a cesarean section in the current uterine transplant regime, and so you won't undergo a vaginal delivery. The uterus is a non-vital organ, of course, so the justification for the risk of undergoing the procedure is controversial. We compared it to other non-life-saving transplants, hand, face, cornea, larynx, and we justified it on those bases. Jacques spoke a bit about the medical risks. There are also psychological risks involved in being a recipient for uterine transplantation, which include documented instances of guilt and depression in other recipients of solid organ transplants, especially in the case of a live donor. So regarding the donor, if the donor is deceased, it's far less ethically controversial, as long as an advance directive is present consenting to the donation of the uterus. In the case of the live donor, of course, there must be documented completion of reproductive potential, as hysterectomy is not reversible, and that woman will have uterine factor infertility herself, short of a uterine transplantation for she herself. The medical harms are the same of a hysterectomy. The psychological harms are the same as a hysterectomy, which have been documented to include decreased sexual drive and problems with sexual identity, but also include those of a donor of a solid organ transplant. The donor can become very emotionally tied to the outcome of the organ, and in cases that the organ fails, there's been documented instances of depression and even suicide. Regarding the healthcare team, it is the healthcare team's role to ensure the Moore's criteria are met. So this is a set of criteria ensuring the ethical execution of a novel surgical procedure. So it's their job to make sure that the research background is present, that the strength is adequate of the fields involved, in this case transplant medicine and obstetrics, and that the institution that carries out the procedure is adequately equipped. It's also their job to ensure that consent is informed and also to ensure that the other criteria are met. So our team put together the Montreal Criteria for the ethical feasibility of uterine transplantation. So assuming that the uterine transplant is shown to be safe and effective, here we propose a set of criteria that may help guide the ethical execution of the procedure. And so we just divided it, as we discussed, into those of the recipient, regarding the donor and the healthcare team, and we hope that it will be helpful to others in the future. Our team is also hoping to discuss some other topics of interest, including perhaps most interestingly, especially given the current social and medical climate, what role uterine transplantation may play in male or trans individuals desiring to gestate a child. So thank you very much for listening, and we're happy to answer any questions.
How many transplants have you done? Is it you who have done?
No, sorry, we have not done the transplants. What we've done is we've tried to actually bridge the animal research that's been done into the human research that's being done currently, in order to make that transition as ethically acceptable as possible.
So it's still in the experimental phase?
Absolutely. In fact, there's been, I think, about 4 documented human transplants in the world. One in the year 2000 in Saudi Arabia, last year in 2011 in Turkey, and most recently about 3 weeks ago in Sweden there were about 2 mother-daughter transplants.
Could you just a little bit details about the last one?
Sure, yes. That was about 3 weeks ago. It's the first mother-daughter transplant in Sweden. There are actually 2 mothers that gave it to their 2 respective daughters, hoping, of course, for genetic compatibility to play a role in the acceptance or the lack of rejection, if you will, of the graft.
So you need to put them on immunosuppressants, just like renal transplants.
And anti-rejection drugs, absolutely. There's a whole registry in the United States about women that have had all its other solid organ transplantations that have then gone on to carry a pregnancy under these kinds of medication without consequence to the fetus. So it seems that it might.
Mullerian agenesis.
So that's actually one of the congenital causes of uterine factor infertility. That's something that we have to investigate in the future.
One short question.
Jan Brynelsen from Sweden.
Yeah.
We haven't had that much debate as you might have expected. But I have one short question. If I understood you correct, you said that the transplantation doesn't improve the quality of life in a direct way. Is that correct?
Well, so
because I don't agree.
I actually saw you make a face at that moment. So what I meant was that so not having a uterus won't affect someone's daily quality of life and won't be life-threatening. Now, of course, in a woman who would like to gestate a child or have another child, it will absolutely affect her life, and that's where uterine transplantation may be very useful, of course.
Yeah. Thank you for clarifying that.
Yeah.
Just on the theme of clarification, you mentioned this as therapeutic innovation. You also mentioned it as research. The two are different. I understand that this is not done as research. This is done as a therapeutic innovation. But any follow-up of doing it through a questionnaire and other tests, I believe would be the research on that.
So absolutely, these procedures will blur the line between research and clinical practice, and those are some of the most grave of the ethical concerns, because there have been some who have proposed actually that a woman who undergoes uterine transplantation in the research context should be considered to be a healthy volunteer. But of course, a healthy volunteer makes informed consent knowing that their choice will help others, while somebody who's going to undergo a uterine transplantation, as I mentioned, is making a social and emotional decision for themselves, one that is inherently selfish, not in a bad way, of course, but for somebody to undergo a uterine transplantation for the good of other people to learn about the procedure, that's very, very, very complicated in the informed consent context.
Good, thank you very much.
Thank you.